Okay, I feel like most people are maybe joining now. Are you happy if we start now, Effie? Great. So hello and welcome everyone to today's virtual open day for the Dietetics Masters course here at UCL. Thank you for joining us. I'm Diana, so I'm a recent graduate actually from the course. I just graduated this year. So I'll be around to answer any questions at the end as well, but I'm only the chair here today. I hope that this session will address any course-specific questions that you have and hopefully gain insight into what it's really like to study on this master's programme. I'm delighted to welcome today's speaker, Dr. Efsata Papada. She'll provide you with an overview of the MSc Dietetics programme here at UCL, followed by a Q&A at the end, where both of us will be happy to answer any questions that you have. Please note that this session is being recorded and will be made available on the website following today's event as well. Now, it is my pleasure to introduce Dr. Papada. She is an associate professor in nutrition and the course lead for the MSc Dietetics program here at UCL, as part of the Division of Medicine. She is also a registered dietitian both here in the UK and in Greece as well. So she has a very varied background. Over to you, Dr. Papada.
Thank you very much, Diana, and welcome everyone. I will now share my screen. Diana, if you could confirm that you can see my screen, that would be great. Can you see the presentation slides?
Yes, we can see it now.
Great. Thank you very much, everyone, for joining today's event, online event. So, as Diana mentioned, I'm Dr. Effie Papada. I'm an associate professor in nutrition. I'm leading the dietetics course, and I'm also a registered dietitian in the UK and in Greece with some research experience and also teaching experience here at UCL and across other universities in the past. So today we are going to give you a brief overview of our dietetics course, and then we will have time to answer questions you may have. But before we start with an overview of our course, let's see what is dietetics. And dietetics is referred as the science of how nutrition affects our health. And you all know that there are a lot of chronic diseases and acute diseases that are influenced by our diet. And so the science of dietetics is more and more important nowadays, given the rising incidence of diabetes, cardiovascular disease, obesity, and acute illnesses. So let's see also what is a dietitian. According to the British Dietetic Association, dietitians are qualified and regulated health professionals that assess, diagnose, and treat dietary and nutritional problems at an individual and wider public health level. And it is important to mention that this title, the title dietitian, is the only food and nutrition title that is protected by law, and only those registered with a statutory regulator, the Health and Care Professions Council, can use this title. And what do dietitians do? So dietitians interpret the science of nutrition to improve health and treat diseases by educating and giving practical, personal advice to clients, patients, carers, and colleagues, depending on the setting they work at. They also advise and help to maintain nutritional status when individuals want to trial dietary interventions such as exclusion diets, nutritional supplementation, or other interventions. And very importantly, they use recognized methodologies to critically appraise the evidence base, which includes all forms of evidence and research to inform their advice. So dietitians require to practice in an evidence-based manner. Dietitians do not only work in hospitals, and there are a lot of roles now out in the workforce and several routes a dietitian can follow following graduation, from hospitals, private practice, food industry, academia, research, sports nutrition, public health, charities, media communications, industry, etc. So the opportunities for dietitians are increasing. And usually they may start with a clinical role in a hospital, but then they may want to try other routes as well. So there are plenty of opportunities for the dietetic profession. But now let's move on to why study dietetics at UCL. So our course will help you become a competent, passionate, and autonomous dietitian. By the end of this, you will be able to deliver evidence-based, service-user-centered dietetic care and innovative public health nutrition initiatives across different client and patient groups and working environments. You will acquire the confidence, knowledge, and skills so that you can translate the scientific evidence about food, health, disease, and human behavior so that you can assess, diagnose, and treat nutrition-related problems in individuals and also the wider population. So our course is a two-year course, and it combines both academic and practice placement learning. And our approach to placement makes use of a wide range of settings so that it reflects the evolving role of dietitians in the workforce. And I will discuss a little bit more in detail our placements in the next few minutes. Our course addresses key concepts relevant to nutrition and dietetic theory and practice to ensure a thorough grounding in the theory and application of nutrition across a range of conditions related to both health and disease across the different age spectrum. And also our course includes a lot of reflection on ethical and practical issues, which is associated with all our modules. And we will be encouraging all students to start reflecting on their practice from the first term of the course until the last. And now let's see what does the course cover. So we have a range of modules across the 2 years covering several topics, starting from nutrition and metabolism in health and disease and across the different life stages. The students are expected to familiarize with several research methods and nutritional assessment methods, as these are core parts of the dietetic practice. As you understand, nutritional assessment is a core aspect of dietetic practice, and research methods are very important so that the student can understand how to critically appraise the evidence base that they will use for their practice. We also discuss malnutrition in the community and across different populations. Professional practice in dietetics is a module that runs throughout the 2-year course, and we start from the basics covering the standards of proficiency for dietitians as they're stipulated by the HCPC and by the British Dietetic Association. And as we move on across the 2-year, we start discussing more and more complex aspects in professional practice. We also have 3 different clinical practice modules where we start discussing about treatment of different diseases and their dietary management. And as I explained earlier, our course includes also quite a big component of practice placements. Part of our modules also include some very fun kitchen practicals at our state-of-the-art teaching kitchen at our Royal Free Campus, where students have the opportunity to experiment with modification of diet, such as managing the fat content of a recipe, the sugar content, the fiber content, exploring specialized diet and modification in the texture of food so that they can learn and appreciate how all these changes that we are suggesting to our patients can be applicable in real life. Moving on, I will just give you an overview of how this 2-year program looks like. And here you can see an overview of the timetable for year 1. So in term 1 of year 1, on Mondays and Tuesdays, we start with the module Professional Practice in Dietetics 1, which, as I mentioned earlier, it covers aspects of professional practice, standards of proficiency, code of conduct, complex ethical issues, and also communication skills, which is a core part of this module. And as you can imagine, communication skills are very important in our dietetic practice as well. There is also the module on Wednesdays, which is called Fundamentals of Nutrition and Metabolism, which covers the basics of human metabolism and nutrition in different life stages. On Fridays, students are practicing on practical nutritional assessment and are learning the theoretical background as well. And they also learn about the different research methods that are essential in research and in evidence-based practice. And towards the end of term 1 in November, we start with our first placement. I will give you a brief overview of the placements in the next few minutes. Term 2 continues actually with the module Professional Practice in Dietetics 1, where we continue exploring communication skills and other aspects of professional practice. We have the first clinical practice module, which is about lifestyle management, prevention, and the food environment. And we have also the second clinical practice module, which is the therapeutic aspects of nutrition. On Fridays, students are exploring concepts and aspects of malnutrition in the community. In term 3 of year 1, we continue with the module Professional Practice in Dietetics 1 on Fridays with some reflection sessions from placement 2A, which starts in mid-May. And we have also some university days in terms of placement 2A with simulation sessions on campus. And this is how year 2 looks like. So in term 1, we continue with the module Professional Practice in Dietetics 2, where we explore more advanced topics of professional practice, and we continue practicing communication skills and how to communicate with more complex cases of service users. Students are also going to their third placement, which is placement 2B from September till October. And on Fridays, we have the module Clinical Practice 3 or Advanced Dietetic Practice, where we explore the dietetic management of more advanced diseases. In term 2, it's the final placement, which is full-time from Monday to Friday, and it runs from mid-January until end of March, early April. And then in term 3, our students need to work on a research project and write up a dissertation, which they submit in late August. And now I will move on to our placement overview. As I mentioned earlier, our 2-year course combines both academic learning and practice placement learning. And apart from the clinical placements in hospital settings, we have also introduced some non-clinical placements in different settings, such as charities, media communication, health tech companies, public health bodies, but the students can explore the different routes there are for dietitians in practice. And let's see now how our 4 different placements look like. So placement 1, which takes place, as I mentioned earlier, towards the end of term 1 in year 1, is equivalent to 10 days. Students are spending 1 day within an NHS setting shadowing a ward round and MDT sessions, and they also visit a catering department so that they can appreciate how food is prepared and served to patients, and different kind of menus that are available to patients depending on their needs. Then the students spend 3 days per week for 3 weeks at university, where we have a combination of simulations, case studies, and peer discussion. In placement 2A, which is equivalent to 50 days, we have 3 days of the first week at university with simulations and case studies so that the students can be prepared for their first clinical placement. And then they go to their clinical settings for 3 days per week for the first 10 weeks. And then for the final 2 weeks, they go to their placement for 5 days a week for consolidation purposes. And so they go to their placement 2A for the first 10 weeks on Tuesdays, Wednesdays, and Thursdays. On Mondays, we continue having simulations at university so that they can continue practicing their skills in a safe environment and develop, get feedback, and then they can continue applying this in the hospital setting. And the final 2 weeks, they go to the hospital settings for 5 days a week. So that is equivalent to 50 days. Placement 2B is equivalent to 20 days, and students are going to a non-traditional setting, a non-clinical setting for 3 days per week, Tuesday, Wednesday, and Thursday as well, in a non-traditional setting, which can include a variety of options, such as I mentioned earlier, supermarket, charities, health tech companies, media communications agencies, industry, etc. And then the final placement, which is placement 3, is equivalent to 60 days, and students are expected to be on a clinical setting 5 days per week for 12 days. And all these placements cover more than 1,000 hours of practice placement learning, as this is stipulated by the British Dietetic Association. And I will close this brief overview here. Just wanted to mention that our program is fully compliant with the latest British Dietetic Association curriculum guidance, which reflects the role of dietitians now and into the future. And by the successful completion of this course, you will be eligible to apply to the Health and Care Professions Council for registration as a dietitian. So I will stop sharing. I would like to thank you for listening, and over to you, Diana.
Thank you so much, Effie. That was really insightful, and that was, yeah, a really good overview of what the course is like. I guess from my experience as well, to put it into perspective as a student, there was so much learning in university in the first term. I feel like they gave a lot of knowledge before we went on any placement, so we felt a lot more competent, and the lecturers are great, and we also get lots of external speakers who are experts in their fields coming in as well. The dietetics course specifically as well, it's quite a small group, which I think really means that you get to maximize your learning as well. Like I never felt nervous asking questions in class because there was only a few of us, and so you get a lot of learning from that. And with placements, I got to go to adult hospital settings and pediatrics, so children as well as there was like Afi was saying, the non-clinical setting as well. That was really exciting. I really enjoyed that one. I got to get involved in like podcast designing for dietitians, and even since leaving that placement, I've seen podcasts come out that I was involved in working in, and like books as well. So there was loads of really cool experiences from this course. So I'd definitely recommend it as a recent graduate. But yeah, me and Effie are both happy to answer any questions, and I know we have quite a few that have come in already. So for Effie, someone says, hi, and thank you for the insights. And what are some commonly asked questions during the interview for the admissions? Will we be given a clinical case?
Thank you very much for this question. So during the interview, we ask questions relevant to your experience and relevant to the understanding of the role of dietitian, and we usually give you some scenarios to work before the interview. So I think we have answered this question.
Okay, great. And are there any in-person exams at any point on the course?
Yes, yes, there are. There are. For most of the modules, there are in-person exams. Yeah.
Yes. And then are MSc students able to collaborate with UCL medical researchers or gastroenterology teams for their dissertation or early research experience?
Absolutely, and this is something that we're really proud of here at UCL. We're a research intense university, and we want our students to be involved in research. And we have 4 different teaching hospitals at UCL: the Royal Free, the GOSH, the Great Ormond Street Pediatric Hospital, UCLH, and also Eastman Dental Hospital. And there are several researchers across the division and across UCL, which you could collaborate with depending on your research interests. So, in case of in the case of dissertation, we gather research topics from all our colleagues that want to supervise an MSc project, but students usually also like to find their own research project. And we've seen in practice that a lot of the dietetic students usually have built a partnership with the hospital they were for their previous placement, for example, and they usually go back and set up a project. So there are plenty of opportunities, and we are doing our best to find a supervisor for the students who is suitable for their research interests. Thank you very
Yes,
much.
absolutely. I can reiterate that as well. There was quite a lot of people who they might have done like an audit whilst they were on placement with it,
Mhm.
and then followed that on as a research project later. And one of our lecturers came in and I did a research project with them because they had one open as well. There were so many opportunities, and if you have one already planned, you can always request it as well if there's something specifically you want to do. There was lots of autonomy on this course, I think. Even in modules, sometimes you'd be given the option to choose your essay title. For example, my nutrition and community, if it was a topic you really wanted to research, they would let you do that as well. So there's lots of opportunities.
Yeah, and just to add, Diana, that also, we always try also to publish results from MSc dissertations in case we have some good quality data and the students want to participate in this. We always encourage the student also to participate in the publishing process, because this is also a very good learning experience, I feel.
Absolutely. And from my experience, because with my research project, we're hoping to do that as well. And we were able to do the dissertation in the style of the journal that we wanted to submit it in as well. So all of the work was kind of done mostly for the dissertation, which really helped set it up for hoping to publish a paper later as well. And there's lots of opportunities to like present your work as well, which is exciting. And I've been very supportive university, especially for research, very good at research. So Diana said it was a small group on dietetics course. How many people roughly are on the course each year?
So we started our course about 5, 6 years ago, when we started building on the number of students each year, because the reason for this is that we wanted to ensure that we had good quality placements where our students would go. So we started building our number, and we expect to take about 20 students per year.
Great. There's a couple of questions answering that, so I
Yeah.
hope it's answered everyone. Are there sufficient band 5 roles to go into after graduating? And do most dietitians go straight into clinical roles? And do they get support with finding roles after they graduate?
Mm-hmm. That's a good question, and there is a lot of discussion across London about the availability of Band 5 roles. It seems that compared to the past, there are fewer roles, but in our course, we've seen almost half of our students every year securing a role even before graduation. And I think, Diana, you can reflect on your experiences on this as well.
Yeah. So for me, so I'm actually in a band 5 role now, and we finished at the end of August. So we had our final placement that ended about March, and then we had Easter break and we had our research project. And I found that during the research project and Easter break time, there was enough time to do some applications alongside. And sort of just as posts come up, applying to them. You might need to be open-minded to how far you can commute and things like that, because they can be a bit more scarce depending on where you live. But I found that it was good. And Effie was really supportive. She helped me prepare for my interview as well. And a few people on my course have got roles. Some of them are waiting to start, and some have started. I know some people also do other things like private work as well. And some people want to do PhDs. So there's plenty of opportunities afterwards. It depends what you want to do. But if Band 5 roles are something for you, there's lots of time to do that and support for that as well. So where would the placements be? Would they all be in London?
So every year we are trying for all of our placements to be based in London. We may have few placements which would be a little bit outside London, but we're trying to have all of our placements based in London. So as you may know, we share placement capacity across London with other universities. So we are trying to get as many placements as possible within London, and we also try to consider traveling time and other student needs when we allocate students on placements.
And what kind of prior experience or background do you tend to look for in applicants? For example, are internships, research experience, or involvement in nutrition-related societies especially valued? If so, what's the most valuable?
So thank you for this question. I think all of these types of experience you mentioned are quite valuable. I wouldn't say that there is one single experience that is mostly valuable. What we would like to see is that students can reflect on their experience and can connect their experience with how this would be helpful to a dietetics career. So any internship, any patient-facing role, public-facing role would be good if the student, the applicant actually can reflect on this experience and how this links to the dietetics role.
Thank you. So there's a few more about placement locations, which we've done. So let me just go through. So someone has a BSc in psychology. Would this compromise their chances of getting onto the course? I know other courses favor biological sciences.
Mm-hmm. So thank you very much for this question. So it is required by the course entry criteria for the applicants to have a degree which has a significant component in metabolism, biology, physiology, any related subject. So, I mean, everyone can apply, but there are a lot of applicants across for this program, and it depends also on as you understand, we have a limited places and there are a lot of applicants, so it depends also on it is a highly competitive program, so it depends also
I think Effie's internet might have gone, so we'll just wait a moment to see if she reconnects. There you are.
Can you hear me? Sorry about
yes,
that.
I can hear you. I think.
Okay, sorry about that. So I was saying that we require for the previous degree to have a component in biology, metabolism, physiology, and this is because the students will be able to follow better the course in terms of the needs of prior knowledge in terms of metabolism, nutrition. So it's good to have a relevant background.
I know from my experience of my classmates, we had such a varied background. So
Yeah.
human biology, some people did nutrition,
Mhm.
some people did neuroscience, some people did sports exercise science. But yeah, as long as you have that background, I think it's important to have some metabolism knowledge for
Yeah.
sure. They can be quite challenging modules, but there is a variety of backgrounds.
Yeah.
Great. And will you accept candidates who've graduated a while ago? So for example, 2019?
Yes. Yeah.
Medical sciences, yeah.
Yeah.
And how is disability support coordinated between UCL and placement hospitals so that adjustments are constantly applied consistently?
So yes, so we support students as much as we can. We have a great university support team, and they after the student discusses their need with the university support team, then we receive what kind of adjustments, we're informed of what kind of adjustments the student needs. And of course, then in joint discussion with the student and the placement providers, we are trying to find ways to support the students as much as we can. Of course, if the student is happy to share information to their placement provider as well, but this is for their own benefit so that they can get as much support as possible from their placement provider.
Yeah, I mean, personal experience as well. They were very supportive of me. I've got dyslexia, and every time we had placement, I would be emailed ahead of time and asked if I'd be happy to discuss it. And my placement supervisors would check at the start if there's anything I needed, any way that I prefer to learn, anything that I'd needed adjusted. So everyone was very supportive. Um, okay, and then someone said, thank you for all the information. And please, could you give an overview of what the simulations are and what kind of traits or values or skills are being sought as applicants? I guess that's two questions. So maybe if we start with what the
The
simulations
first one, the
are.
simulations.
Yes, yeah.
So we have a variety of simulations, and we have some actors been involved and pretend to be the patient so that the students can start applying their communication skills, their skills on how to assess a patient, how to discuss a dietary plan. And this is a very good opportunity for the students to practice their skills in a safe environment, get feedback instantly from tutors, and then it's easier and less stressful when they go to a hospital to talk to a real patient. So Diana, what is your experience on this?
No, I was going to say, I definitely, yeah. So we did simulations before going on any of our placements, and I found that particularly useful for scenarios that I'd never been in before. And a few of my classmates, we've all had different experiences, so it's great to have a bit of experience. And even now working, I see I have a clinic today, and even when I go to clinic now, I still think back to the clinics I did with my lecturers and think, what things were I thinking about? How's the layout of the room? All the things that we had to think about before we were in a stressful, more situation with a patient there. We were sort of in a safe environment to ask questions and get feedback on our communication style and the type of questions we're asking, and really think about what's relevant for this case. We had lots of different cases that we could practice. So it really gave us a good background so that when we're there, we feel more confident in what we're doing. We've also did loads of case studies, presentations as well, which was helpful just to think about what are we thinking about when we're doing an assessment, doing that as a group as well, so we can get ideas from each of us. It really just helps with your like logic and thinking that you can carry on placement and work in the future as well. But yeah, and the lecturers who got involved are very lovely and supportive. It can be funny acting sort of with people that but it's nice to have that safe environment of that. And what time frame are the interviews or set?
Okay, so usually the interviews take place around late March, mid to late March.
Great. And someone asked about how many people are on the program, which I think we've already answered, and how large are the teaching or tutorial groups?
Okay, so when it comes, as this is something I didn't mention before, and thank you for asking this question. So we have some shared modules which with the other three MSc nutrition program, which are the fundamentals of nutrition, the research methods, practical nutritional assessment, malnutrition in the community, and therapeutics aspects in nutrition, which are shared modules with the other nutrition MSc programs. And we have the bespoke dietetics modules, which are the professional practice in dietetics 1 and 2. We have the clinical practice 3 and the placements. So it depends on the module when it comes to the size of the tutorials and the group. So when it comes to the dietetics bespoke modules, as Diana mentioned, we have a small group. We don't expect to have more than 20 students per year. And usually the tutorial groups are a similar size in other modules. So when students are collaborating with other MSc Nutrition students, they work into small groups. They can have some group activities, some group presentations, some tutorials, no more than 15, 20 people per tutorial.
Thank you. Okay, and then someone asked about the ratio of applicants to places on the course.
So usually we receive more than 150 applications per year for approximately 20 places.
And someone asked about the placements being in London, which we've already answered, and about reasonable adjustments as well. Perfect. So, for example, they've asked specifically if someone was suffering with epilepsy and maybe struggles in a busier hospital environment. That's, yeah, it's quite a specific question. So it might be the case of, emailing perhaps if you
Yeah.
more specific questions like that.
Yes.
There's an email which perhaps Emiliana could send about if they wanted to ask a question like that's more specific.
Yeah.
Right. Someone's asked, what hospitals do students usually go to?
So we have a variety of options. We have general hospitals, acute settings. We have also pediatric hospitals. We have community settings. We have eating disorder clinics. So there is a variety of placement settings.
There is. And I think UCL is very lucky that they have some of the best universities in the world linked to them as well. So
Yeah.
very, very lucky situation at this university. And there's a few more about how many applicants, which you've answered now. Is there support with going directly into a private role?
We are always open to support as much as we can, and also we have included some sessions within the module of professional practice and dietetics where we have a seminar on how to set up your own business, and we also invite people that work in non-traditional roles that have set up their own business. So we try to support this route as much as possible.
Thank you. And someone asked as well, is there flexibility for students to specialize or gain more exposure in specific areas such as gastroenterology or metabolic disease during placement rotation?
Diana?
Yes, I was going to say that one. Yeah, so I mean, I had experience in both of those areas on my placements. So I was in metabolic diseases in children for 6 weeks, and I also had gastroenterology for 6 weeks as well. And I know that, so I had that in pediatrics for gastroenterology, but some other students, they had they were in an acute adult setting and did gastroenterology in that setting as well. So gastroenterology, there was definitely quite a few opportunities for that in 2 different types of acute settings with different patient groups, and metabolic disease, that was an option as well. So it just depends, obviously, which placement you end up on, but Effie's very supportive with listening to what we prefer and what our interests are in. So I did say I wanted to do pediatrics, and she managed to support me with that. And so yeah, they are very supportive in whichever interests you have. And someone asked, so Diana, did you find that you had time to do part-time or full-time work while studying? So I personally didn't do full-time or part-time work. I think full-time would be very extremely challenging, but some people did manage to do part-time, more flexible work. It would be quite challenging to get specific hours throughout the whole 2 years because the timetable does vary quite a lot, and sometimes you might be in for full, working hours of the week. But I know some people did do some work sort of like babysitting or other work that was a bit more flexible and they could do it in the evenings. And in terms of funding as well, so I mean, I can say from my experience, if you want more information on funding, there's information on the website. But if you're an England resident, for example, you are entitled to getting the undergraduate student loan. So even if you've used the student loan in the past for a previous degree, you're entitled to it again. So that means that you get most of the university courses funded and also extra support for maintenance loan as well, depending on household income. And there's also the Learning Support Fund, NHS Learning Support Fund, which provide £5,000 each year that you're studying any NHS degree, I believe, but yeah, this degree. There is also university specific, so UCL do a master's scholarship or bursary where it's only a certain amount of people get it, but for anyone who is struggling financially, they'd be more likely to get it, and that's up to £10,000 as well. So there is plenty of support out there. If you are able to get support, I would choose that, of course, because it can be quite challenging to manage extra work. But yeah, there are options. But just be aware, I think, yeah, routine work would be quite difficult, I would say. I'm sure Effie would agree.
Yeah.
To focus on the course. Great. And then, and also if you're from different areas, so different countries, just check what would be available to you because it can be different depending on the country you're in. So UCL might be able to support you with finding information that's specific for you. And have students been able to work with the same team or hospital they had their placement at after graduation, if interested in them? Thank you. Yeah. So I know one person that has now got a job. They're due to start soon at one of their placements, and that's happened in previous years as well. I know someone else who was offered one, but they decided not to go for it. But there is definitely a bit of a link, and the experience that you gain from placement and knowing their specific team and environment definitely helps you. I think you are limited to if they have a job opening is the only thing I will
Yeah.
say. It's not sort of automatically that you would get one, but if there is a job opening, then yes, that has happened. So we've heard that it's a competitive program. How many applicants you receive? We've answered that one. Could you tell us more about support systems in place during placements? So are there designated mentors or supervisors that will work with regularly? And how independent are students expected to be whilst on site?
Okay, I will start with the last part of the question. So we follow a stepwise approach in our placement. So that means that we don't expect students from day one while on placement to be independent, but we follow a model that is called the no-can-do model. So at first, we want the students to start showing that they have the knowledge and know how to run a dietetic consultation, for example, know how to gather information, etc., know how to behave professionally. And then as we move on to the next placements, we expect them to start being able to show this more consistently with support. And then by the end of the placement 3, we expect them to demonstrate their independence and manage by the final 2 weeks of placement, the consolidation phase. We expect them to manage a small caseload as they would do as a first-time appointed Band 5. So we don't expect them to be independent from day one, and they are supervised while on site. In terms of support from the university, we are in close communication with the placement providers. We conduct halfway review meetings with the placement providers and the students so that we can see if there are any concerns, gather feedback, see how we can improve the placement experience for both sides. insights. And we also gather feedback after its placement, both from the placement supervisors and the students, so that we can can continue improving the placement experience.
Definitely. Effie came out, halfway through each of our placements to make sure everything was okay, and she was always there if we needed anything throughout as well. And yeah, we've got supervisors as well on site. So could you talk a bit more about the written exams? Are they during year 1 and year 2, and are there any mid-year, or are they just at the end of the year?
So the majority of the written exams take place towards the end of each term. And we have also some oral presentations exams as well, which may take in the middle of term 1, for example. It depends on the module, but the majority of the written exams take place towards the end of its term. And we also try to ensure that there are no exams, of course, during placement periods.
Yeah, and they're in both years as well.
Yes.
Yes, yeah. When are students notified if they've been selected for interviews?
So after the deadline for submission, which this year is somewhere, I think in the middle or towards the end of January, please check the website. So we take some time for our panel to review all the applications thoroughly. As you can imagine, it takes some time because we have more than 150 applications to review thoroughly and read its personal statements, see all the qualifications, the previous experience. So it takes us some time. Usually, we aim to inform students in early March.
Thank you. Does the program depend on GPA and grades?
So we require a 2-1 grade from the previous degree, or if you have another MSc, we want to see a merit at least. So yeah, we have these entry requirements.
Thank you. Thank you for the insights. And can I ask when the final offers are sent out, which we've just answered? Can the applications close earlier than the stated deadline? Is it better to apply sooner rather than later?
No, we don't review any application unless we have all the applications gathered at the end of the deadline. We don't start reviewing before that, and so no, you can apply by the final day of the deadline.
And will master students also have a personal tutor like undergraduates do?
Yes, we have.
What are the teaching styles of lectures? Are they structured, approachable, warm, or friendly?
Diana, this is for you.
Yeah. So there is a range of lectures. So particularly in the first term and the second term of the first year, you'll mix a lot with the other nutrition master's courses, which is really nice because you get to sort of learn from a lot of expertise. There's a lot of a variety of people who join all these nutrition courses with really varied background experiences. So there's a lot of learning from them. And so those environments are more like 150 people in those lectures. But I'd say even in those environments, the lecturers usually are there at the end if you want to ask any questions. And they always ask questions, at the end of the session as well, whilst everyone's there. And they're always happy to answer questions on email as well. I feel like anyone that I have asked a question has been very supportive. And then in terms of the more course-specific lectures, so there's some throughout year 1 and year 2 for just the dietetics course, and it's a smaller group, so around 20 is what Effie was saying. And that environment, I'd say, is very supportive. I never felt nervous to ask any questions. They would answer any questions, and the lecturers who come in, there's a variety of lecturers. There's lots of dietitians themselves who will come in who are specialists in their area and will teach about their area, from their perspective working on the ground. And they're happy to answer any question. And I'd say it's a great opportunity to ask questions because you rarely get that where you have someone happy to answer and has the time to answer any questions that you want to ask. Yeah, I'd say that it was always quite comfortable. Even if you're nervous to ask during a bigger lecture, there's always opportunities. Um, and the structuredness of them varies. So some sessions, like we had a diabetes dietitian who came in who got us involved in carb counting and weighing out rice. So it's, a bit more interactive, whereas others are just sit down and listening. It varies a lot. And we've got cooking sessions, like Effie said. There's lots of variety of sessions. Are all lectures in person?
The majority of the lectures are in person. We may have some invited speakers who will join online, but the majority of the lectures are in person, yes.
What does a usual day as a dietitian look like? Well, I guess it
This is
varies
for
a lot.
you. Diana, this is for you.
So for me, from a band 5 sort of acute hospital adult setting, which I guess is like the classic that you would think of, a typical day might look like, so if I was seeing patients on the ward, I might come in and have a look at any of the new referrals that have come in on the ward. I prioritize, which patients need to be seen first. I'd prepare to see them, go onto the ward and speak, and then come back to finish writing my notes. And then there might be other things in the day. So if there's any meetings, if there's any presentations like this, there's lots of extra things as well. And then I also have a clinic once a week. So I'll prepare for that beforehand and then go see everyone in clinic and then finish my notes and send any letters off afterwards. So that's what a typical day in my setting looks like. But of course, the dietitian role varies a lot. I think since coming in this course, I've really learned how many doors it opens doing the dietetics master's course. I was kind of nervous before starting if I was narrowing down into quite a specific job, but actually there's so many opportunities. So some people, so like one of my placements was in a media communication setting, and they work completely from remotely, and they liaise with companies, and their day looks completely different. They might get involved in book writing and blog writing and podcasts. And Effie, of course, is a dietitian herself, and she's involved in research lectures, everything.
Yeah.
Um,
So it depends. It depends on the setting you work. But if you refer to the clinical setting, then as Diana mentioned, this is a typical day.
and if you work in the community, it might be visiting
Yeah.
patients in different settings, in the community as well. So lots of variety. But happy to answer any more specific questions about that as well. So what is the proportion of international students, specifically Asian countries?
Well, usually every year we have 20-30%, I would say.
And UCL as a whole is one of the most
Yeah, we
international
are a diverse
universities.
environment, so everyone is welcome.
Yeah. And does the course cover autoimmune diseases?
Yes, it covers. Yeah.
And there was another a question about reasonable adjustments for the interview,
Mhm.
certain circumstances.
So if anyone needs any reasonable adjustments during the interview, they can email our admin team's email address, which is pasted in the chat, and we can provide additional support as needed.
Thank you. And just a reminder, we've got 5 minutes left, so we'll answer as
Yes.
many as we can in the time. I'm sorry if we don't get to all of them, but we'll try our best. So are there any type of materials you recommend familiarizing ourselves to aid in preparation for the course?
So usually our admin team before the start of the course will share some recommended reading list with the students so that you can start familiarizing with this before the course.
Yeah, and if you want to do any outside reading, there's also places like the British Dietetic Association has resources. But yeah, I wouldn't worry too much. You learn a lot on the course, so is all teaching in person or some online? Like we said, most in person, but there are some online lectures as well, but most are in person. And are placement costs covered?
So you can find more information about this on our funding page, and also you can go to the NHS web page in the Learning Support Fund, and you will find more information there as well, because there is some support available.
Yeah, so there's the Learning Support Fund payment. I said the 5,000 each year, but there's also extra if there's additional costs for
Yep.
anything that you need. So just that's the best place to look. Does UCL feel like an environment where you could thrive and be inspired to be a competent dietitian? I would say absolutely.
And this is for you, Diana.
Yeah, I would say, yeah, I think ever since doing the course, I've never regretted doing it one bit. I've always felt inspired. You get to see so many different dietitian roles, so much research going on. My eyes were open to the amount going on. You know, even now that the university has meant I've had opportunities to go to different conferences as well, where, you know, continuing to get inspired. But no, it's a really great environment. And I think you get as much out of it as you get involved. So I think the more you get involved, you'll get more out of it. So ask questions, speak to people, you know, make the course your own. You can really do a bit of tailoring to what you prefer, your research project, everything, make it what you want to do. And I think you'll get the most out of it that way. Great. And then I've been finding it difficult to secure direct experience in the dietetic setting. Would you say that experience or shadowing in any healthcare setting would be just as valuable for applications?
Yes, if the applicant reflect on their experience and try to connect how this can be relevant also to dietetics, yes,
Yeah.
this is very valuable.
And I say that's throughout, even as a dietitian, any
Yeah.
experiences outside, you're always reflecting, they're always applicable to the dietetic setting as well. There's so many transferable skills. I mean, we have people on my course who were doing jewelry making in the past and doing, you know, there was so much background in sports science and working with athletes. There was a variety of different past experience that can be applicable. So as an NHS dietitian, is there any scope for some home working, or is it Monday to Friday on site at the hospital? Definitely nowadays there's a lot more opportunity for flexible working. So I'm personally quite new to the role, so I'm not yet doing that, and just that's more for my own comfort. I'd like to be around the team to ask questions if I want to. But some clinics, for example, might be telephone clinics you can do from home. There might be days where you've got some extra like learning to do that you could do from home with your admin work as well. There's definitely more opportunities, and some trusts do video appointments as well. So yeah, everywhere that I've been on placement and worked in as well, they've definitely had a mix of some working from home as well. Yeah. Are the lectures recorded?
Yes, the majority of them are recorded. I mean, usually we don't record tutorials or you know, some group work tutorials because we just have small groups working in parallel. But yeah, the lectures are recorded.
Is there a priority for students who may be currently at UCL studying a nutrition course?
So we treat all the applications the same. So we once we have all the applications after the deadline closed, we evaluate all the applications and we treat everyone in the same way.
Thank you. And then the last question, unless there's any more, but I know we're at the end of our time, so
Yeah.
I managed to answer everything. So are mature students welcome? And if so, is the recent study required before applying?
Mature students are welcome, and we had in the past several mature students who have successfully completed the program. And recent study, I mean, if you meet the requirements in terms of your bachelor or another MSc, you're very welcome to apply.
Absolutely.
Okay.
Yeah, don't worry. I mean, I had a couple of years off, but I know quite a few people had a few years off, you know, since their degree before starting. And it can be nerve-wracking at the start, but I think you get straight back into it as well. Thank you very much. I think that's all of our questions. Thank you, Effie.
Thank you very much, Diane.
Thank you. Thank you, everyone, for your questions as well. Hope you have a lovely rest of your day. And just to let you know as well, we've also got the opportunity for to learn about our life and medical science open evening, which is on campus in person on the 19th of November. So if you'd like to meet the nutrition dietetics team in person, you're more than welcome to sign up via the link that's been shared with you in the chat. It will be shared in a moment. Thank you again, and have a great day, everyone.
Thank you very much, everyone. Thank you, Diana.
Thank you.